Good afternoon. Thank you all so much for being here. I am Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners, and we are so honored today to have our Acting Physician General, Dr. Denise Johnson, and our Deputy Secretary of Health Preparedness and Community Protection, Ray Barashansky, with us today. We are honored to have them tour our vaccine facility here in Montgomery County to see how we are giving flu vaccines and COVID-19 vaccines. What we are here today primarily is to talk about the flu. And before I turn over to Dr. Johnson, I just want to thank our staff here at Montgomery County. These folks do an amazing job. They are here every day taking care of our community. We've had numerous volunteers through our Medical Reserve Corps. We want to thank them as well. And it's an honor to be able to show off our work here today. So with that, thank you, Dr. Johnson.
Thank you, everyone. Good afternoon. Well, I'm very happy to be here, and thank you to Montgomery County Human Services for hosting this event and letting us get a chance to see the great work that they and all of their staff are doing. Right now, we are in the 2021-2022 flu season, and flu activity is increasing. Our laboratories have reported flu, influenza A and influenza B, and we have continued to see these cases. Over the past week or so, most of the cases that we've seen have been influenza A, but we have had reports of flu from all 67 of our counties. We know that we are also seeing flu activity at our emergency departments. Even though last week the activity was a little bit less than the week before, we're certainly well above what we have had last year. So far in this flu season, we have reported 28,475 flu cases, and unfortunately, we've had 16 influenza-related deaths so far. Currently in the season, we have flu that is circulating, but we also have COVID-19 that's circulating. And I think that many of you know that a lot of the symptoms of flu and COVID-19 overlap. And so to get the real definitive diagnosis, it's really recommended to have a test. We know that we've got great tools to protect us against severe illness and hospitalization from flu as well as from COVID-19. We know that the COVID-19 vaccines are available for individuals, everyone 5 years old and older, and the flu vaccine is recommended for everyone 6 months older, and really recommend that you get these vaccines to get that measure of protection. Remember, the flu vaccine doesn't protect you against COVID, and the COVID vaccine doesn't protect you against the flu. You need both. So this year, we want you to stay safe. We want you to be vaccinated. We want you to remember to take the precautions. Remember to cover your cough and sneeze. Remember to clean, wash your hands frequently, and to contain. If you're sick, stay home and don't mingle with others. I'm going to turn this over right now to our Deputy Secretary, Ray Barashansky. Thank you.
Good afternoon, and thank you, Dr. Johnson. I really appreciate it. I want to extend my gratitude to Dr. Arkush, the Commissioner. Thank you very much for having us here, and to the entire Montgomery County Health and Human Services team for having us here today as well. Thank you. My name is Ray Barashansky. I'm the Deputy Secretary for Health Preparedness and Community Protection at the Pennsylvania Department of Health. Dr. Johnson did a great job outlining our current state of flu in Pennsylvania. The CDC is reporting that the majority of flu cases are in the eastern and central parts of our country. Additionally, CDC's early estimates are that fewer people have gotten the flu vaccine this year, that's fewer, than last year. This is discouraging since we're seeing significantly higher cases this season. The good news is it's not too late to get your flu vaccine today, and the flu vaccine remains the best protection against the flu. While we do recommend getting flu vaccine at the beginning of the flu season, it's not too late to get it today, tomorrow, or even next week. Please remember that the sooner you get your flu vaccine, the better. It's safe to go to your doctor's office, pharmacy, a local walk-in clinic, or even a grocery store to get your flu vaccine. This year, both the flu shot and nasal spray are available and recommended to protect yourself against the flu. Your doctor or pharmacist giving you the vaccine will be able to discuss what the best vaccine for you is. Getting a flu vaccine will not only keep you from becoming severely ill, it'll also protect your family, your friends, your coworkers, and all those you may come in contact with this flu season. If you do get the flu vaccine and you still do get the flu, your illness will likely be less severe. It will likely last a shorter time, and you will most likely avoid hospitalization. And as Dr. Johnson said, anyone older than 6 months should get a flu vaccine unless they are allergic to it. Flu vaccines are offered at doctor's offices, at pharmacies, at local walk-in clinics, and even at grocery stores. And there are seasonal flu vaccine clinics distributing flu shots to anyone aged 6 months or older to protect against the flu, like the one here in Montgomery County. A full list of upcoming clinics is available at health.pa.gov. And right now, we have clinics listed at the Veterans Affairs Medical Center in Coatesville, in West Norriton, in Delaware County, in Erie, in Philadelphia, and in Pittsburgh. And there are also ongoing clinics in Allegheny, Chester, Erie, York, and of course, here in Montgomery County. To segue, our department's epidemiologists monitor flu activity and provide the latest data weekly on health.pa.gov. And those epidemiologists are also providing guidance for flu safety messaging. At the Department of Health, we have bi-weekly meetings with a multidisciplinary working group in place to assure we give the latest information to relevant stakeholders about flu, as well as what we're seeing on the ground so that they can better prepare for what they are seeing as well. Internally, this group includes members of our Bureau of Epidemiology, our state laboratory, our Bureau of Health Promotion and Disease Prevention, and of course, our Office of Communications team. And externally, we have the Hospital and Health Association of Pennsylvania, the Pennsylvania Medical Society, and the Public Health Management Corporation. I want to thank you for coming today, but I also want to turn things over right now to Commissioner Dr. Arkush.
Thank you.
Thank you.
Well, I just want to thank Acting Physician General Johnson and Deputy Secretary Barashansky for coming to Montgomery County. We're so proud to be able to show off our program and our team to you, and I know they were very, very happy to be able to meet you. As you've heard, the annual flu vaccine is free, and it is the best way to protect against the flu and its potentially serious complications. In Montgomery County, we want to make it as easy as possible to stay up to date on your vaccinations. So we continue to offer the flu vaccine along with the COVID-19 vaccine to anyone who is attending one of our county COVID-19 vaccination clinics. To date, the Montgomery County Office of Public Health has administered more than 3,000 doses of the flu vaccine at our combination COVID and flu vaccination clinics this season. So far, we've been averaging between 100 and 200 flu vaccines each week at these sites. Keep in mind, these numbers are only for the shots given at our county sites. As you heard, you can go to pharmacies, your doctor's office, a local grocery store. There are many, many places where you can get a flu vaccine, and you should do whatever is most convenient for you. We are happy to say, unlike the trend that you just mentioned, we are actually ahead of where we were last year in the 2019-2020 season in administering flu shots here in Montgomery County. So we just really want to thank our community for stepping up and taking every step that they can right now to keep themselves and their families and our hospitals safe. You know, we spent a lot of time talking the last couple weeks about how busy our hospitals are and the importance of the COVID-19 vaccine and the flu vaccine to make sure that we minimize the number of people who require hospitalization. There is still time to get vaccinated, and this is the best way to protect yourself against the flu. As you heard, flu shots are recommended for anyone 6 months of age or older. To make an appointment at one of our clinics like this one, you can go to montcopa.org/flu, or you can call 610-278-5117. We have locations in Willow Grove, King of Prussia, here in Norristown, and Pottstown. And as I said before, the shot is at no cost to you. And I also just want to reiterate that you can get the flu shot and the COVID-19 vaccine together. Whether you're getting your initial COVID-19 vaccine or a booster, if you want to do both, we would be happy to give you both on the same visit. Again, we want to make this as easy and convenient for you as possible. So thank you so much for listening, and we want to encourage everyone to come out and get that flu vaccine. Thank you.
Thank you, Dr. Arkosh. Well, we'd be happy to take any questions for any of us. Have a question?
I just had a question.
Yes.
The Deputy Secretary
Yes.
said that the numbers of people getting the flu shots in Pennsylvania are down. Do you have any reasoning as to why that is?
We have not, that is what we are seeing. However, there is no specific reason for it. And one of the reasons why we have events just like this is to reiterate to people that the most important thing is to go out and get your flu vaccine. So thank you for highlighting it again. Our numbers may be down, but with your assistance, we can get them up. Thanks.
Do you think people are vaccinated out? They keep hearing about the COVID vaccine, the COVID vaccine. Do you think
What?
do you think people are just so they keep
Oh,
hearing
vaccine.
that
Sure.
there's a COVID
Oh, got it.
vaccine, and then there's just one more vaccine to get?
Sure. I mean, that certainly could be a reason, but again, we want to reiterate that the flu vaccine is really important, that it can help keep you out of the hospital, and that even if you've gotten your COVID vaccine, the flu vaccine won't protect you against the flu. So we do encourage people to get both. Other questions? Yes. Oh. Any other questions? Great. Well, thank you so much for coming out. We really appreciate it.
Thanks, everyone.
Registration area, and then generally what they would do is we have the colored tape on the floor. They would follow the line that is designated with what they're receiving. But since all our fun media friends are here today, we're gonna cover
No
it.
problem.
We're gonna great job. And then over here we have our draw station. So we pull out our draw, harness to your new system boosters, and J&J. And then once that's done, they go across the hall to the polling area.
Okay, and that's where they get monitored before they.
Yep. So we have, they're tracking all the numbers, they're tracking all the products. So Jen's awesome. We love when Jen's working.
Thank you.
And then these are our